One of the big problems with healthcare, and Wujao, you may have some information about this as well, is that for decades, of course, since the industrialization of medicine and sort of all the doctors' practices, about the practices, is that patient records are kept on individuals. Different health organizations, and I guess in municipalities, wherever they're governed, all the patient records are separate. HIPAA laws are relatively new, but patient confidentiality means that patient records aren't shared. And ironically, because of privacy, and it's understandable, people are entitled to their privacy. Gotcha. Here's the thing. Valuable information about diseases, ailments, epidemiology, and so on and so forth are not shared because those records are private. And what I'm going to say, no one's going to like, is about the privacy laws. I'm a proponent of privacy. I want my privacy. I want the right to have my privacy. Okay. However, there are some aspects of our overall society that I think we have to work at how we can maintain our privacy but allow certain information to be shared. Sounds crazy, right? Because we know we're looking at Big Brother. But at the same time, I think what happened was that there was some disease in the Midwest somewhere, a decade or so ago. It was spreading around, and doctors in one healthcare region had no idea of it. Then the disease came into their region, and they started to see a few more cases. And it was only after some sort of national, convention or something, doctors realized, oh, we've been seeing cases of that over here, because those records are not shared. So the controversial thing, guys, is that in some crazy way, maybe not crazy, the smart people can set me straight, we kind of need to look at privacy and think, okay, in which areas and how can we maybe allow certain information to be shared, maybe anonymously. Maybe say, hey, there's been X amount of cases in this region without giving the names and addresses. Do you know what I mean? Contact tracing, maybe we can eliminate that. But I honestly believe that with endometriosis, for example, there are a lot more women who are suffering it, and the numbers are kept isolated, okay? And so those doctors aren't sharing information either, and they're not contributing to trying to eradicate these issues. So I know you may not like it, but I think part of the solution may be if some aspects of medical records are actually shared among people who are doing honest research. Let me put it that way.